On 5, count 'em, 5 Sunday morning talk shows, the guests will be Obama, 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 and Obama. That's never been done before. 5 shows, the president on every one. But Mr. Obama is using every forum he can to push for his health care reform plan. There's been a lot of discussion this week about whether some of the criticisms of the president's plan might be based on race. George Stephanopoulos asked him about that when his interview was taped this afternoon, and George is joining us. George?
And Charlie, we spent about 20 minutes with the president in the Roosevelt Room just off the Oval Office. As you said, he's pushing health care this week, but we covered a lot of other ground, including those questions about race. White House officials have dismissed those who say that racism is motivating the president's opponents, but this was the first time the president addressed it personally. And I asked him if it frustrated him that his allies like President Carter see racism in places where he doesn't think it's at play.
Well, look, I think that race is such a volatile issue in this society, always has been, that it becomes hard for people to separate out race being sort of a part of the backdrop of American society versus race being a predominant factor in any given debate. And what I've said when we talked about during the campaign, are there some people who don't like me because of my race? I'm sure there are. Are there some people who vote for me only because of my race? There are probably some of those too. The overwhelming part of the American population, I think, is right now following this debate, and they're trying to figure out, is this going to help me? You know, is health care going to make me better off? Now, there's some who, setting aside the issue of race, actually I think are more passionate about the idea of whether government can do anything right. And I think that's probably the biggest driver of some of the vitriol right
raise
now.
Their taxes?
Is, well, it goes beyond taxes. Anytime there's a president who is proposing big changes that seem to implicate the size of government, that gets everybody's juices flowing.
And George is joining us again. George, the debate on health care itself seems to be revolving principally now around the Baucus bill, the bill introduced by the chairman of the Senate Finance Committee this week. But at the moment, they don't have the votes to get that out of the Finance Committee, do they?
Boy, they don't. It's taking heat from both Democrats and Republicans right now, Charlie. But it does meet some of the basic principles that the president set out. It reaches towards universal coverage. It doesn't increase the deficit. But the president is concerned, I think, especially right now, with criticism coming from Democrats, some who see the lack of subsidies there as equating a middle-class tax increase, others looking at possible cuts in Medicare. And he's really pushing, wants the process to move forward, even if this bill is going to require some changes and some amendments as they go into that markup next week.
But the debate is going to revolve around that as principally the center and the most likely bill, right?
That is the big game in town right now. The president's still holding out hope that it might attract some Republican support, including Senator Olympia Snowe of Maine. But what they're really focused on now is trying to rally the Democrats, unify the Democrats so they can get it out of the committee, onto the floor, and this can keep moving forward. All
right, George Stephanopoulos in Washington. And of course, you can see George's entire interview with the president Sunday morning on This Week.